little look at the budget. Well, wait, maybe before I do that, I'll tell you about confirmed cases first. So in the city of St. Louis, this was first thing this morning, so probably more by the end of the day. 924 cases in St. Louis, 42 deaths. In St. Louis County, again, 8 o'clock this morning, 2,417 cases, 96 deaths. And in Missouri, the whole state, 6,137 cases and 208 deaths. So as you can see, this does not even include St. Charles County, but St. Louis City and County together have about 3,500, 3,400 cases. And so we are well over 50%, just those two counties in the state of Missouri. Now, is today the 22nd? It is. Today's the 22nd. I'm just looking at the dates here. So this afternoon at 3 o'clock, Dr. Garza, who, as you know, is the incident commander for the St. Louis Metropolitan Pandemic Task Force, he said the number currently hospitalized today is 685 people. That is down 65 people from yesterday. And so, hopefully we can continue to see that go down. What's been happening has been going up and down a little and up and down. So that's very important, that we hope to see those numbers can start to go down. So that's a report right now on the number of cases. I do want to talk for just a minute about the budget. And for any of you that are really interested in these numbers, I'll try not to bore the rest of you. You know I'm an accountant, so I like these numbers. People here in the room with me are laughing at that. But some of you out there are numbers people. And if you are, all of these numbers in this presentation, I'm just going to talk a little bit about, are online. And they were put up maybe about an hour ago. And so they're online. You can look at the presentation. You can look at the budget numbers and come up with questions of your own based on looking at those numbers. Friday morning at 10 o'clock is the public hearing for the budget. Of course, it's going to be virtual this year. That's never happened before. So it'll be a Zoom meeting, and there are instructions online as to how to hook into that. So bottom line, this budget is extremely sobering. We are looking at $30 million down in this year that we're in, which we've only got 2 months left in this year, May and June. And we're looking at close to $40 million down next year. And so there's a lot of time spent in this presentation going through how we are actually going to have a balanced budget, which we're required by law to have. And that's not even the worst possible budget. It's still a very bad budget. The worst that we can ever remember having in this city in terms of the amount that we will be down. 28 million really for this fourth quarter that we're in, and then 40 million for next year. So for those of you that are interested in taking a look at that, go online and look more at the budget. We're front hiring freeze, except for police, water department, corrections. A meeting that it was about an hour and 10 minutes. Paul Payne, who's
pretty high.
Mm-hmm.
Is that a solution to the shortfall?
So the city's fund balance, we call it the reserves, is a little over. It's in here. It's about 35 million, I think, is the number right now, and we've built that over the last few years. And we hope not to have to dip into that. We're trying not to. Here it is right here. 42 million, excuse me, not 35. 42 is what it's supposed to be at the end of this year that we're in. Now, we know that it won't go up this year, but we are very hopeful that we don't have to dip into it too far because, you know, when I came into office, the city's fund balance was, I think it was 16 million 3 years ago. And so it has been built up somewhat, but I have to tell you, that's not much of a savings account for an entity that's running $1 billion budget. And of course, it also constrains us, it doesn't allow us to have as much flexibility as we would like to. So we're hoping not to eat into that fund balance too much.
Another budget question, Mayor. Are there things in the budget that are non-starters for you that you think that absolutely cannot be cut, whether they're employees or crime prevention or is everything on the table?
Well, there's a lot that's on the table, but honestly, we are trying to keep people employed. We have in total about 6,600 employees in the budget, but 750, I'm looking for the exact number here. Yeah, 6,607. 750 of those jobs are vacant right now. Almost 150 of them are vacant police officer positions, which we still need to hire and want to hire police officers. So we are trying not to lay anyone off if we can figure out how to do it. We are probably we're putting a pause on raises. 1.5% is the normal city raise. So, you know, it's hard when you're cutting and you realize, you know, well, certainly we can't cut the health department right now. Certainly we can't cut the police department. We're actually up in terms of number of homicides so far this year. This is yesterday's number. I think it's still a good number, though. We had 46 homicides year to date yesterday as compared with 38 the year before on that same date. So, you know, we've got a lot of very serious situations. So is there anything that's a non-starter? I mean, I don't, everything's on the table with a caveat that we're going to try to continue to have enough employees to provide services for our residents. I mean, this is about humanitarian. We've already cut capital. We've cut in this proposed budget, we've cut ward capital, which is a very tough one. I hope we're going to be able to bring some of that back, which is the capital that is spent at the local level. But it's a very sobering budget.
Last budget question, I think, so far. What is the biggest change in this year's budget over last year's budget, aside from, or maybe that is the biggest change, just the devastating impact of COVID-19?
Yeah, the biggest change is having a $30 million decrease in your revenue and another $40 million predicted for next year. That is the big change. And so then a lot of items that we were going to do, such as it's called a PSAP, which is a public safety answering system. We put that on the back burner. We have taken funds out of special funds and put them into the general revenue budget to try to balance that. We have not budgeted for any furloughs at this point. We have communications. We've cut the ash tree removal program. We have stopped capital expenditures for many of the projects that were going to be spent. We've also, we have reduced the budget for the medium security institution, MSI, almost in half because we have fewer people there. And so that has gone from 16 million to 8 million. This is round numbers. And we only have about 120 or 30 people at MSI right now. It's got a capacity of 1,400. And so at any rate, we've reduced it in half.
No budget questions.
You don't even like numbers, Jacob.
I don't. Ian, so
This
you mentioned.
guy's
We got to get rid of that. Ian is watching, and Ian has asked. You just mentioned putting a hold on the raises. Are you talking about the 3% raises that you enacted for fiscal year 21 for city employees?
And the 1.5%.
And the one, yeah. Okay.
Yes.
So on hold. So on COVID-19, one of the questions we got was our counterparts in Franklin County are beginning to relax a lot of their social distancing restrictions beginning either today or this week. So people are asking, how are people in the city of St. Louis protected if someone from outside the city where there are less restrictions come into the city?
We're really not. We're a very mobile, fluid society, of course. There are people who live in Franklin County who work in the city of St. Louis and vice versa. So, we're all in this together, but we're all still moving around. The protection that you have, there's a couple things. One, social distancing, 6 feet apart. 2, wear a mask when you're out or even at work. I mean, we wear masks here in the office. So you just have to be very vigilant about those protections because, there are people here in our city and in St. Louis County and Illinois and Franklin County who have COVID-19 who we don't know because they're asymptomatic. So these behavioral changes really need to stick.
Jennifer is watching, Mayor, and
Hi,
Governor
Jennifer.
Parson has indicated that he's going to begin opening the state again on May the 4th. So our stay-at-home order, you will be back with further guidance by the 15th. What about that gap of 11 days or so? Who takes precedent if the state's open before us?
Local governments. So the governor, we've talked with the governor about this, and there are 114 counties in Missouri, and we're just not all alike. Some counties are denser than other counties. As I said at the beginning, the St. Louis region, we have well over 50%, close to 2/3 of the cases in the whole state. So we just have a different situation here. And, I know that there is a great desire to reopen the economy, and I share that desire. I absolutely want to reopen the economy just as soon as we can safely do so. And, we haven't hit the peak yet, we don't think. And so we need to see some decline in cases before we have a big opening of our economy.
Mayor, the other day, State Treasurer Scott Fitzpatrick tweeted that the state of Missouri had received a $1.2 billion wire transfer from the federal government for COVID-19 relief. Lashana Lewis is asking, when is the city of St. Louis going to see any part of that money?
So the city of St. Louis's allocation is about $53 million, we've learned. And the state is supposed to give us the first 25% within 10 days, according to law that the state passed just here a month ago. So hopefully we'll get some of that money, maybe 12, 15 million within 10 days or so.
Can we follow up and ask what we are allowed to do with it or what's intended to happen with it?
So that's part of the issue. There are no regulations for this money yet because they just haven't written them. Here's what we know in sort of general terms, that it can be used to reimburse us for direct COVID spending. So that would mean a lot of the PPE that we've bought. That would mean testing that we're trying to get delivery on, we've ordered and need to pay for. That would mean perhaps some of the efforts in the health department. So it's COVID-related expenses, money that we've paid to procure additional beds for or unhoused. All of those things we believe fluorescent, which they just started doing testing to the public today. If you feel that you need a test, I'm going to give you the phone number here. It's you still have to call Affinia and go through a screening process. It's 833-2777. That's 314 area code. 833-2777 is Affinia. And Care STL Health also has a screening site at 5471 Martin Luther King. The number there is 314-367-5820. And there are several Affinia sites, a couple of Care STL sites, and a couple also in the county. One just over the city limit line on page 67, 63 page, which is just a wee bit out of the city. So you can call either one of those phone numbers, be screened, and if you meet the screening requirements, get a test. Now, that being said, we still need more tests because we just can't get a big enough supply of the swabs or of the test. We are meeting with hospitals. Dr. Eccles is procuring them, trying to buy them everywhere possible, several vendors. Up until now, they have, many of them have been diverted to places that have a lot more cases, New York, East Coast particularly. So we still need more tests, and having more testing, whether it be the diagnostic testing known as PCR, or whether it be the serology test, the test that you can give someone to figure out if they've had COVID-19, both of those, we need more tests.
This is kind of an interesting question. So after we begin to relax our restrictions and the stay-at-home orders begin to lift, will these testing sites still be in place? Will we still be testing the public even as the stay-at-home order goes away?
Yes, we will. We have to, because what we have to do is continue to watch for blips, for increases in cases, which is often what does happen when you begin lifting the stay-at-home order, and when folks maybe get more casual about the social distancing and washing their hands and that sort of thing. So often that does happen, and these sites, we do expect these sites will continue to stay open.
Rachel's watching. Her question is, can I get a marriage license through the mail?
I don't know, Rachel. But it's the Recorder of Deeds office who issues marriage licenses. And I think that's Michael Butler is the Recorder of Deeds. And we'll look up the phone number for you here during this. Tommy, can you do that? Okay. Tommy's going to look up the phone number so we can give it to you. You can call there. I know there is a process, but I hope you're able to get one soon. Congratulations.
While we wait for the phone number, how is the city of St. Louis doing compared to other similar sized cities in terms of response, outbreak number of cases, places like Kansas City? And this is the recorder's phone number.
Okay, this is the number for Rachel. Is it Rachel? No.
Yeah, it was Rachel.
It was Rachel. You still watching, Rachel? I hope so. Here's the number for the Recorder of Deeds, 622-4610. All right. Good luck, Rachel. So ask me that question again. Oh, how are we doing as compared with other cities? Well, I think that I think we're doing fairly well. And the reason that we're doing fairly well is that we put the stay-at-home order in place pretty early. It went into effect March 23rd. Schools closed, I want to say it was on March 17th, maybe. I might be off a few days there. So we're doing fairly well because we expected the number of cases to be much worse than what they've turned out to be. But the reason that we've done better than we feared is that we had the stay-at-home order in place. And frankly, the people of St. Louis, city, county, people of the region have have really taken this to heart, and those that can are staying home and social distancing and not mixing it up socially. Of course, we know there are a lot of people still working, and I just want to thank them profusely. But even the folks that are still working are wearing masks, are social distancing, are taking extra precautions because we, don't. This is a very contagious virus, and there is no preventative. There's no shot that you can get to keep from getting it yet. There's no vaccine, and there's no medicine to make you get better. So that's why this is such a serious situation.
Nikki's watching. What happens, or what should maybe someone do if you're like at the park, Forest Park, and you see groups of more than 10 or people just not listening to social distancing?
Well, I think if you're at the park and there's a big group of people, I think you have to carefully, nicely be sure that you keep yourself away from them, because that's ultimately only you can be responsible for yourself. So keep yourself away from them. If you feel that it's a situation where you can suggest that maybe, hey guys, spread out, you can do that. And if not, you can call 622-4800. That won't be addressed that day, most likely. That's our Citizen Service Bureau line. And if it's a really big situation, you can call 911.
So two people are asking about the court building, which they've been closed to the public.
Mm-hmm.
But apparently it sounds like maybe some people are still getting juror summons. So how should people know if they need to report if they're still getting those in the mail?
Well, that's a good question. I didn't know that juror summonses were still going out because the courthouse is closed. I would assume that the summons is for a date pretty far in the future, because at some point the courthouse will reopen. So if the date is far in the future, you'll hear more. There is a phone number I know on that juror summons. I know that because I've gotten those summonses myself. And so you could call that number or go online and look that up. But I'm just making the assumption that if you got a summons now, it doesn't ask you to report for another month or something like that. I know there's usually a pretty good lead time on those. So just stay tuned in, call the number on the summons, because right now there's no juries going on.
Is there a magic number, Mayor, when it comes to testing for how many in the city of St. Louis you'd like to see done per day to feel comfortable with lifting orders and relaxing our restrictions?
There's not a magic number for how many per day, but what it does need to be is anyone who we need to be able to be in a position to have a big enough stockpile of tests and or swabs and medical and lab capacity so that anyone who has any of the symptoms who we'd like to be tested is able to be tested. I don't know what that magic number is, but certainly it is more than we have now. We don't really have any tests that the city itself has, and we've been able to order some tests and get them in from a couple of different places, and we've supplied the federally qualified health centers with some of those. We've worked with the hospitals; they're also procuring tests. So I think testing has to be prevalent enough so that we all know that if we have some symptoms, we're able to get the test. And the tests are a bit rationed right now.
How's the city of St. Louis doing in terms of staffing more contact tracing to get a better idea of where the virus could be spreading in the community?
Our health department is doing a great job at contact tracing. And what that means is if you have someone who has a positive test, COVID test, that then you want to get in touch with them or the people that are close to them to see, well, who is it that person who's positive has come into contact with, who then might be at risk of also contracting COVID-19. And so our health department has an elaborate process for that. Anyone who is being self-quarantine because they've had an exposure, those people go online twice a day. They're given a thermometer. They take their temperature. Twice a day they answer several questions. So they have to stay in touch with the health department electronically twice a day. If for some reason you don't put your information in or you miss communicating with the health department. They call you on the phone. They go to see you. There's a whole number of steps to follow up with those individuals who are being watched, being monitored because they might have an exposure. Over the last 6 weeks of this, there have been many, many, many people who have been quarantined for 14 days or 14 days since their last exposure and have come off of that quarantine and not ever developed symptoms. So that is a rolling group of people.
Are people in the city getting better from COVID-19 and recovering from this and making like a full recovery?
Yes. I mean, that is the good news. Many people do recover from COVID-19. And you're beginning to see some of these cases. I saw some on TV last night. And so, yes, people do recover from COVID-19, but some don't, unfortunately. And a lot of people have COVID-19 and actually don't end up going into the hospital even. When you look at today's hospital numbers, what was it, 685 today? Well, just in St. Louis City and County, there have been 3,500 cases, close to it. Many of those cases did not end up being hospitalized. The ones who ended up being hospitalized, though, I happen to have these numbers. Of the 685 that are in the hospital today, almost 200 of them are in ICU, and 133 to be exact, are on ventilators. And that's a very, very serious situation.
Just a few more questions. Can you close some city streets so people have more room to walk?
I think we've had that question before, and I'm not opposed to closing city streets. Most of you probably know that we have closed most of the streets in the major parks. Carondelet Park has one street that's still open. The other major parks, Wilmore, O'Fallon, now you're going to test me here, Fairgrounds, Forest Park. There's 6 major parks. Forest Park has about a third of the streets that are already closed. So if you have a suggestion, I'd be more than happy to hear from you on that as to what street you want closed. We're fortunate. We have 109 parks in the city of St. Louis. Almost everybody in the city lives pretty close to a park and is able to walk there. They're not all close to the 6 major parks, but even a park that's a block or 2 blocks around is still a good place for you to walk, get outside, get some exercise. I recommend you do it today. It looks like it's going to start raining here pretty soon, and the forecast is rain for the next few days. So we all need to get outside for our physical health and for our mental health.
Do you know of a place where someone in a low-income or underserved neighborhood community could get free PPE?
So we have been providing PPE to a number of agencies, such as nursing homes, that sort of congregate care facilities. Just in terms of a place to get free PPE, I don't know of a place to do that. I hope that once PPE, it has loosened up a little bit, but once it loosens up more, my hope is that, we can hand it out to anyone who needs it. But the thing to do here, the most important piece of PPE is a mask, and to wear the mask when you go out. And you don't have to have a fancy mask. I got a new mask yesterday from the Urban League, and I think the Urban League is going to be passing out some of these. This is very cute, isn't it? It's got the city flag on it. I wore this today when I was at Affinia. And so take a t-shirt, old t-shirt, take a bandana, a handkerchief that you have, and use that as a mask. That's the most important piece of PPE that you can have right now. And hand washing with soap and water. Soap and water is better than let me see that stuff right there. Here we go. It's better than this hand sanitizer. But if you don't have soap and water, use the hand sanitizer.
Okay, lighter question. What about ice cream trucks, Mayor, during the stay-at-home order?
Sorry, no.
Okay, that was fast.
Sorry, no ice cream trucks. you know, so.
A question from Alexis over at Channel 4.
Hi, Alexis.
She is writing about I think this is the Wayfarer tax, the e-commerce use tax that's being debated in Jefferson City. So the Municipal League says that without it, some local municipalities and governments could be bankrupt because of how much COVID-19 is costing. Where do you stand on the Wayfarer tax and the impact it could have on the city of St. Louis?
We have been supporting the Wayfarer tax for this. I think this must be the third year. Maybe it's only the second, but it seems like for a long time. And we have been lobbying in Jeff City to pass the Wayfarer tax. And so for those of you who don't know, here's what it is. When you go to the store and you buy something, you pay sales tax. But when you order something online, sometimes you pay sales tax, sometimes you don't. Often you don't. And Wayfarer, this case that went all the way to the Supreme Court, that's why it's called that. Wayfarer says, hey, everybody has to pay sales tax. When you order it online, they call it a use tax, but it's a difference. And so we think it's only fair to the brick and mortar stores, the folks that are there day in and day out paying rent in a building where you can go in and buy stuff and you got to pay your sales tax. We think it's only fair that you have to pay that when you order online. And the reason for that is just, why should ordering online be an advantage over being able to go to a store? So yes, we are in favor of that. We've been lobbying for that. The Municipal League has also been in favor of that all along. So we hope it gets passed.
This might be our last one.
Okay.
What about, or has the city begun to thought about swimming pools this summer, rec centers, summer programming for kids in the age of COVID-19?
That is a tough one. We are thinking about it. We don't have all the answers yet. There's, do we open pools? We've got about another month, 6 weeks to figure that out. You think about it, we've only been dealing with for about 6 weeks. So we've learned a lot in the last 6 weeks, and a lot has changed. So a lot will change in the next 6 weeks, I think. Our rec programs, our summer rec programs are not happening as of right now. We do think they're important. We think they're very important. Kids, young people need stuff to do. So, our rec centers are closed right now. So there may be a way to do some of that this summer. We are also, we have a program called STL Youth Jobs that gives young people 16 to 24 jobs and job skill training and that sort of thing. Last year, they hired about 800 young people. We are hoping to be able to have enough funding, maybe not quite as much as last year. So we'll probably try to call on some of the private sector to help shore that up even more so that we continue, because we do know it's so important for young people to have jobs and to learn those work skills and continue. So those are all things that we are thinking through right now.
I think that kind of does it for our questions today, but you can wrap up however you like.
So the wrap up is go online and look at the budget for those of you that are numbers people. The wrap up is thank you. I know this is tough and there's a lot of stress out there. I hear from people. I hear from you on Facebook. I hear from you, through all kinds of ways, emails and all that. And I know there are a lot of you out there that are really pushing to reopen right away. And we're making every effort to ease what we can without causing another spike in COVID-19. So this is all changing really day to day, frankly. I think you're going to see the state open back up May 4th, I think it is. And we'll see what that looks like. We're talking with industry groups, hotels, restaurants, about how you could reopen. I think the question for you all to think about right now is, would you be comfortable right now going back to your favorite restaurant, going back to going out shopping for shoes or whatever it might be? Would you be comfortable going into big situations? And if so, under what conditions would you still want to wear a mask? I think it's one thing to say, okay, we're going to reopen a bit, but it's a whole nother thing. I think the public has to be comfortable doing that. And as much as I miss being able to be out and about, I think we all have to think really very long and hard and seriously about that.
Anything else?
Thank you all. Bye, Facebook. Is today Wednesday? We'll see you on Friday, I think. Thank you so much.
Is there a magic number, Mayor, when it comes to testing for how many in the city of St. Louis you'd like to see done per day to feel comfortable with lifting orders and relaxing our restrictions?